Hello and welcome to our first episode of our webinar series. My name is Sara Alem and I'm the MENA Regional Focal Point for the Migration team at the United Nations Major Group for Children and Youth. And on behalf of UNMGCY, it's my pleasure to welcome Elena Habersky to our first episode of our webinar series today, where we'll be discussing the impact of COVID-19 on migrants in the MENA region. Elena is the current project manager of the Refugee Entitlements in Egypt project at the Center for Migration and Refugee Studies at the American University in Cairo. She has an MA in Migration and Refugee Studies from CMRS and a BA in International Studies from the University of Scranton. She has spent the last 8 years working with displaced populations in Amman and Cairo and has conducted ethnographic research with Darfuri and Congolese refugees in Egypt, Jordan, and Uganda. Elena, thank you for being with us today.
Thank you so much, Sarah. It's lovely to be here today.
Absolutely. It's our pleasure. Migrants are more vulnerable than others because of personal, social, situational, and structural factors. Their vulnerabilities may be exacerbated in crisis situations, as it is in the case of COVID-19. Elena, having witnessed some of the difficulties that migrants went through or are still going through, what are some of the challenges that COVID-19 posed on governmental services offered to migrants?
Yeah, thanks so much, Sarah, for the question. So I think first off, as the project manager, as you had mentioned, of the Refugee Entitlements project at CMRS, I oftentimes see the difficulties of accessing services in Egypt, especially when it comes to refugees and asylum seekers who are forcibly displaced migrants, right? So all refugees and asylum seekers are migrants, but not all migrants are necessarily asylum seekers or refugees. So I just want to make that distinction in the beginning. So when I use these words, people hopefully can follow along. So while Egypt has many solid laws for certain entitlements when it comes to, for example, healthcare, where there's a memorandum of understanding between UNHCR, so the United Nations High Commissioner for Refugees, and the Ministry of Health and Population within Egypt, or for example, education, where certain nationalities can access public primary school on par with nationals or slightly higher fees. So in Egypt, that's Sudanese, South Sudanese, Libyans, Palestinians, Syrians, and Yemenis. There are oftentimes gaps between sometimes the law or what the law says and what's happening in practice. And unfortunately, for many of these gaps, they've been exacerbated by COVID-19. So let's give a few examples. So I'm going to stay with education, which I just mentioned. So for those migrant communities that are able to register their children in the public school systems, so the ones I have just mentioned, many of their residencies expired in the beginning of COVID-19. So during the first few months of the pandemic. And UNHCR was not operating at full capacity for various reasons, to not only keep their own staff safe, but to also keep the populations that they work with safe. So it was very difficult to help the refugees extend or register through the Egyptian government, which was also in the beginning not operating at full capacity for the safety reasons that I had mentioned. So thankfully, UNHCR informed the Ministry of Education that there was this issue of residencies expiring. Because usually when you register your child into the school system, you need to have some form of residency to enroll your child. So the Ministry of Education waived this paperwork, which was very good. It meant that many populations were able to register their children within the public school system as usual. But as you can imagine, there are also many instances where schools were in person and then cases were rising and then they went online, or maybe they'd been online for, a while. So for many migrant populations, especially refugees and asylum seekers, they might not have great access to Wi-Fi or to data, or it may be very expensive for them to pay for Wi-Fi or data for the amount needed for their children to attend school. So these were like two issues that we saw particularly in education. Today's actually the first day of school for the public Egyptian schools. So we're hoping again for a very positive experience this year. Teachers have to be vaccinated per government regulations. But as we know, unfortunately, some of the children are too young to be vaccinated. So again, we're hoping for a positive experience and outlook for this year, but we do see that there have been some challenges with regard to education. Another entitlement, which we can't not discuss, I think, is healthcare. Again, as I mentioned previously, there's a memorandum of understanding between UNHCR and the Ministry of Health and Population, which allows refugees to access public, primary, and secondary healthcare on par with nationals. So this is something that's really great in the law, and many refugees have been able to take advantage of this law. However, as one can imagine, COVID-19 made accessing healthcare difficult, especially when cases were rising, there were certain waves, right? And of course, this is not only something that's affecting refugees and migrants, but it's also affecting Egyptians as well, as one can imagine. We see this not only in Egypt, but throughout the region and throughout the world, of course. A lack of beds, for example, can be an issue, or staff who are overworked, or perhaps there are certain staff who need to be in certain hospitals at certain times. So for example, just to give one example, I know of a friend who needed a particular kind of surgery. And he went to a public hospital where he thought a particular doctor was who could help him, but found that that doctor was moved to try and help the COVID situation. So then had to kind of bop in between different hospitals to finally find someone who could treat him and his issue. So you can see here how something perhaps non-COVID related is still affected by the pandemic, especially when it comes to healthcare. For most migrant workers, perhaps they're not refugees or asylum seekers, they access private hospitals. And of course, private hospitals can range in prices from very affordable to very expensive. And at one point, especially in the beginning of the pandemic, we saw private hospitals charging really inflated prices for beds, especially with people who had COVID. So in this instance, this was out of reach for many migrant workers unless they were, of a particular socioeconomic bracket. So this is, again, one challenge that we saw. Of course, we can imagine other entitlements and issues posed by COVID-19. For example, in the beginning, particularly speaking on Egypt, where I'm living, there was a curfew and there was limitations on cafes and restaurants, where many migrant workers work, especially in the hospitality sector in these fields. Many hotels were also closed. Tourism obviously took a big hit. So this led not only to a loss of money, which you can imagine for many migrant workers who perhaps send money back home as remittances, but also just to live here. So we saw instances where people had difficulties paying rent and housing, which obviously can lead to protection issues, not only for the migrant, but perhaps any offspring, any children they may have. For better or for worse, these limitations, thankfully, didn't last very long. And most people, I would say, are living life as they have been before COVID-19. Which of course is far from perfect, but for many, I think the situation is better than it could have been and what we have seen in other countries. So I think for that, we are grateful.
Yeah, this is actually very enlightening and informative because you don't get to hear this in the media. And this will actually bring me to my next point, which is media coverage and migrants. Did media channels and outlets shed enough light on these issues, specifically these issues and migrants?
Sure. So I think in the beginning, we did see a few articles, for example, and I'm particularly in this case looking at Egypt and Jordan, where I previously worked for 3 years. I mainly was following the news on those two countries. So as a research center at the Center for Migration and Refugee Studies, we espouse a human rights-based approach when it comes to migration. So in the beginning, we wrote ourselves 3 articles on the situation. 2 were obviously in English, Egyptian Streets, and for the Cairo Review of Global Affairs. And in the beginning, we wanted to speak to the importance of including migrants in the vaccine rollout system. And I'll talk later about this, but thankfully that occurred. But right in the beginning, we thought this is important. We need to get this out, not just for Egypt, but perhaps, as this talk and this series is talking about the region, for the region, which hosts, a large migrant population, whether they be domestic workers or refugees or asylum seekers, or even IDPs, internally displaced people. So we really wanted to see that come to fruition, that these populations who are extremely vulnerable in most instances would have access to the vaccine system. We also wrote an article for the OECD, which just spoke to general issues facing migrants in Egypt, like the curfew that I previously mentioned, or limitations on the hospitality industry. And there were also other articles which spoke to the issues facing Egyptian migrant workers abroad. So those who mainly go to the Gulf for work and for Jordan. One was by AUC economics professor Dina Abdel Fattah for the Economic Research Forum, and another one was by Emma Wallace for Info Migrants. When it comes to Arabic, I think it was mentioned. When I looked at the news, I remember seeing mentions, but I wouldn't say it was a main focus. Mainly it was, okay, what is the situation? How can we keep everyone safe? Because in order to keep our society safe, we have to include everyone. So, there are instances and mentions, of course, of migrant populations and refugees. It's impossible not to discuss, especially within the Middle East and North African regions. But I wouldn't say it was like a direct and sharp focus from what I could see within the media. If I'm talking about Jordan, because it's something that I'm obviously still interested in, having lived there and worked there for 3 years and still having acquaintances and friends there, there is interestingly an article on Egyptian migrant workers in Jordan. In the beginning of COVID-19, Jordan actually imposed one of the strictest lockdowns worldwide. It affected everyone, but especially migrants. So according to CMRS research, which was done in 2016, at that point, there were approximately 636,000 Egyptian workers in Jordan. And the article mentioned between 700 and 800,000. So this makes sense, an increase within the past few years. Again, this was all numbers before the lockdown. And of course, if you live in Jordan, if you go to Jordan, everyone knows that the Egyptian migrant workers are, heavily involved in especially the hospitality sector and restaurants and cafes and hotels and resorts and these kind of places. So when Jordan initiated this lockdown, many Egyptian workers found themselves without any money or little money. In normal times, many Egyptian migrant workers send money home as remittances, and they keep a small fraction to live off of. It's important to mention, I think, that Egypt is actually every year one of the top countries for receiving remittances worldwide. So you can imagine the toll this had on the GDP of Egypt. So at the end of March 2020, many Egyptian migrant workers, but of course not just Egyptians. This article specifically focusing on Egyptians, but you can imagine that this affected all migrant workers in Jordan. Many found themselves without money to be paid. Maybe their employers failed to pay them because of the restrictions. Banks, money chargers, courts were closed in Jordan. And even the workers who perhaps wanted to return to their countries of origin, be it Egypt or somewhere else, were stuck because many airports had closed. So they were unable to travel, but they also didn't necessarily have the money they had in the past to survive. And of course, in Jordan, as you can imagine, there were many articles that I found about refugees within the country. Jordan hosts one of the top, Jordan is one of the top hosting countries of Syrian refugees, obviously as it borders Syria. And as of September 2021, they have 758,330 registered refugees. Again, not only Syrians, but other populations as well. So I think, it was something that was talked about in the media. Again, not a direct focus, but it's obviously that it was something that people were interested in and concerned about and wanted to see how COVID-19 would affect these particular populations. So yes, to answer your question in a very long way, it was something that was discussed, but I don't think it was a main focus, which in a sense I think is good, because sometimes, when you focus media or attention, especially on vulnerable populations, sometimes, a negativity can come about from that. And I think what we saw kind of didn't take that route, which I think we're all very thankful for. So there was an interest, but again, not a laser sharp focus where there could be a negative attitude towards these particular populations, especially as I'm talking about Egypt and Jordan.
This is very, very interesting information, actually. And I love one thing that you said, that in order to keep everyone safe, you have to include everyone. And this actually brings me to my next point, the GCM and the Global Compact for Migration, that constantly tries to include everyone and make migrants part of the global population where they move to, wherever they move to. And in light of COVID-19, what are your thoughts on the status of the implementation of the GCM in the Arab region or the MENA region?
Sure, Sarah. Thank you so much for that question. So I attended an online webinar in March 2021. It was the first time United Nations organizations and regional experts from the Middle East and North Africa met for the first time in 2 years to discuss the implementation, as you mentioned, the Global Compact for Migration. It's the first negotiated agreement between governments that really covers or tries to cover all dimensions of international migration. So this particular online session was held to discuss the specific challenges women and child migrants faced and the obstacles posed by COVID-19 to the implementation of the GCM. Of course, it could not be discussed because it changed the way our world works. So just a bit of background, as you had mentioned, maybe for those who don't know, the GCM was first adopted by the majority of UN member states at a conference in Marrakesh, Morocco, and it was formally endorsed by the UN General Assembly in December 2018. So one can imagine that a lot of the work since the adoption of the GCM and the past few years has been delayed due to the onset of COVID-19. Something I think in December or 2018 or even 2019, we could never have thought of or even imagined. It should be mentioned, I think, that the goals of the GCM, there are multiple goals. So according to IOM, or the International Organization for Migration, which is the UN Migration Agency, it is designed to determine who enters and stays in a territory and demonstrate commitment to international cooperation on migration. So as I mentioned, many different countries are coming together to try to cooperate on certain migration aspects. It also presents an opportunity to improve member states' migration policies and also strengthen the contribution of migrants themselves to sustainable development, to making migration something that is both positive and sustainable. So although it's a non-binding document, which I should mention, has caused many sometimes internal contradiction due to divergent views of countries, as you can imagine, divergent views, interests of governments and stakeholders. However, the GCM has tried to set a range of actionable commitments it expects from member states on these issues, so including follow-up and review of these policies. So I think that's just important to mention so someone can try and get a footing in this.
Absolutely.
So on this conference that I attended, what were they discussing? So it was noted that some of the issues obviously affected by COVID-19, one of the main ones being reproductive health services in many countries in the region were cut or severely limited due to lockdowns and curfews. So this prevented many from accessing basic health care. There was also, unfortunately, an uptick in sexual and gender-based violence cases. Yet, because of COVID, not many protection services were available as they were before COVID-19. In addition, family reunifications were halted as international travel came to a standstill, as we saw. And this also limited other matters, including refugee resettlement, which saw its lowest numbers in the past 2 decades, and also information on just where to access essential healthcare services was unavailable in the target language of many migrants and refugees in the region. So these were issues that they saw. One other major concern that was mentioned in many countries in the region was not including migrants and internally displaced people. So, people who have moved internally within their own countries and their COVID-19 national plans. So not only were they not included, but sometimes they weren't even, brought to the table to say, okay, what do you think perhaps your community needs? Or, how can we help you best going forward? So these were some issues that faced particularly adult migrants. When it comes to protecting migrant children, whether those who travel perhaps with their parents to a destination country as a migrant worker, or those who were born in the country of destination, either to migrant workers, refugees, or asylum seekers, protecting these children is crucial. And this can obviously be implemented through national systems and special procedures that always put the child's best interest first. So as I had mentioned before, equal access to education and healthcare is obviously crucial, along with other services, and these must be guaranteed. So impediments, or any impediment to accessing these essential services, obviously put children at risk. Moreover, documentation for children is also crucial, especially when it comes to registering a birth, which we saw perhaps didn't take place in the beginning of COVID, because as I mentioned, many government offices had closed for their own safety. However, without such documentation, especially when it comes to children, there's a risk for statelessness for a child, which comes, as you can imagine, with the whole entire set of difficulties and other circumstances that are at the detriment to the child, and obviously do not put the best interests of the child at heart. So I wish I could be more positive in this case. They were trying, the people in this webinar were trying to be positive, but they really wanted to be honest that this is what COVID-19 has done in the region and has affected the implementation of the GCM. So right as they were starting to, hopefully implement all of these, policies and wishes, that, they had all these issues that they were facing due to COVID-19, which not only affected adults, but children as well. They were hopeful, though, that, as vaccinations were starting to occur, that in the global review of the Global Compact for Migration, which will take place this upcoming May, or should take place this upcoming May 2022, that there could be a change, that they would see a change, that services would begin operating more as normally, that offices would remain open, and that, these issues would hopefully be a thing of the past, and that they could move forward in a better future.
I think we all hope so. Thank you so much for sharing your experience and what you heard and saw in this event. It's very, very insightful. And I also want to add that I think COVID-19 shook the entire world, and not just the GCM and the implementation of the GCM and their plans to ameliorate what they already had. But it was an event that shook the entire world in a way that I don't want to say it's good, but it kind of highlighted some of the weaknesses in different systems, healthcare or aids to migrants and different situations. And I think that the GCM moving forward, it's good that they're discussing what happened during COVID-19, because this will also help them achieve their goals in a better way in the future. And I think this brings us to maybe the next point, the SDGs, the Sustainable Development Goals that the United Nations has for 2030. Do you think that there are possible workable solutions, or some of the goals that can be used for the GCM or for different countries in the region to implement, or that can help them in the future to make migrants part of the action plans, not just for crisis situations like COVID-19, but to be part of the society as a whole? Do you think the SDGs have some goals that can be implemented?
Sure. So I think you're 100% right. Like, COVID-19 shook the entire world. And while some things I think are unfortunately going back to the way they were when maybe they shouldn't, I do think a lot of people were, as you said, they saw sometimes the gaps or things that maybe weren't working right, and they said, no, we need to change this, we need to fix this. And I think, as you had mentioned, the Sustainable Development Goals hopefully can be a blueprint for us going forward to see, okay, how can we do this? How can we make it better? How can we bounce back better? So yeah, I think the Sustainable Development Goals can be used, as I said, as a blueprint. workable solutions to help reduce inequalities for migrants, not only in Egypt and in Jordan, but in the entire region. So for example, goal number 3, good health and well-being, obviously. So this could go from including migrants in healthcare plans, which can be, done in different ways, but most obvious, I think, off the bat is including migrants in vaccine rollouts, which thankfully we are seeing in Egypt and in Jordan. If we want to go deeper than that, rather than stay on the surface level, this is like having laws in place, like I mentioned, the MOU, the Memorandum of Understanding between UNHCR and the Ministry of Health and Population, which allows refugees and asylum seekers to access public health care on par with nationals. In Jordan, for example, primary, secondary, and some tertiary services are available to all registered refugees from all nationalities, but at a non-insured Jordanian rate at public health centers and government hospitals. So I think these are good systems that are in place. I mean, of course, there's always room for improvement, but I think right now we can say, okay, at least the laws are in place to try and go towards this good health and well-being from the Sustainable Development Goal number 3. Egypt, for example, in addition, has started rolling out a national health insurance scheme. It will take approximately 14 years to implement, which we look at and say, okay, this is going to take maybe a while, but it's a great start. And when we talked to government officials for our project, we were told that this scheme would eventually cover migrants, including refugees and asylum seekers, as well as migrant workers. So we hope that, this is really, really great news. While it may take years to see the full implementation, with Greater Cairo being one of the last areas that they're going to try and bring this health insurance scheme to life, we can be hopeful that this will be an inclusive health insurance scheme. So we're very much looking forward to that, and we're hopeful that it will include everyone. Because again, as you had mentioned and I had mentioned, in order to have a healthy society, we need to include everyone. There are also different ways, I think, which we can finance healthcare for migrants in the MENA region. I think a lot of times people are put off, how are we going to pay for this? How is this going to go forward? But I think there are certain ways in which countries can do this, which again, not only helps the migrants, the refugees, the asylum seekers, but the country, as a whole. So for example, when it comes to funding COVID-related healthcare costs, emergency funds and donations can be earmarked through including a percentage of expenditure towards healthcare for refugees and migrants, and specific services, of course, which are crucial, such as like hygiene facilities and including and giving, masks, make sure there's access to potable water. On a national level, you can advocate that the government, for example, creates a COVID-19 supply bill in addition to the national budget and accounts for migrants and refugee communities within this. Additionally, we've seen in some countries that national systems could consider earmarking specific taxes, such as on cigarettes, and these could be used towards their expenditure of COVID-19, which can go towards, helping everyone. Health insurance can also be provided to refugees and migrants with formal work contracts, either through a national health insurance scheme set up specifically for migrant populations, or an additional measure for those employing refugees and migrants during the pandemic. It could be setting up small group health insurance systems, which can cover, depending on how many people are employed, cover them and integrate them into the social health insurance, which could, be achieved through a flat rate premium. So for example, whatever their contribution would be based on what they make. This can also happen from community organizations, which, for example, in Egypt, we see a lot of community-based organizations. Again, it can go also over a household premium, because we know, for example, the amount of refugees in formal employment, be it in Egypt or Jordan, is not necessarily very high, but it would still be able to use a flat rate premium maybe for everyone, disregarding how much they make, but making it affordable. So I think this type of health insurance would cover the cost and treatment, for example, of migrants and refugees if put into practice and thought through from different governments within the region. So this is for SDG number 3, good health and well-being. For SDG number 11, for example, we're looking at sustainable cities and communities. And I know this is also an SDG that IOM and many other organizations that work with migrants like to adhere to and like to discuss, because it does take an entire community, right? Especially within urban settings. For example, Egypt doesn't have any camps. Jordan does, but the majority of refugees in Jordan, about 83%, are urban. So they're living within communities already. So to have a sustainable city like Cairo, like Amman, to have sustainable communities, I think is something that everyone should be, working towards and espousing to. So how do we make these huge metropolises like Cairo, like Amman, sustainable for all? So in Egypt and Jordan, many signs, for example, are both in English and Arabic. So I think this is a good start. Obviously, there are migrant populations who don't speak or maybe don't read English and Arabic. For example, in Cairo, we have extremely diverse migrant communities who speak a wide array of languages, including Oromo, Tigrinya, Dinka, Noor, Somali. So these are just to name a few. But I think, it's a good start. So I think also different ministries, if they're trying to target these populations, can try and have TV campaigns, newspaper ads, radio ads in these other languages besides English and Arabic. Thankfully, many of the organizations that I know who work with migrant populations in Cairo and Amman publish information in a wide variety of languages. So if there's something important from the government, if there's something important from UNHCR, it's published in these perhaps smaller languages compared to English and Arabic, but still incredibly important for many, many refugees, asylum seekers, and migrant workers. In addition, I also think there can be language classes readily available and free of charge for those who want to learn Arabic and English. This would answer, I would think, a lot of questions, especially some instances in Cairo where we've heard that, it's progressive realization. For example, getting refugee children or migrant children into the school system. We want them to, but they don't speak Arabic. And, the public schools are in Arabic. So how can we overcome this? I think by, having these classes, especially within the neighborhoods that we know are predominantly where refugees, asylum seekers, and migrant workers, live. We can make them either free or at a very, very low cost. And I think this would really help with local integration and to make sure that especially children don't go without the crucial importance of an education. But also, I think for parents and for adults, to feel more comfortable speaking to their neighbors, and for perhaps the Egyptians to learn more about the people who are living next to them. And of course, there are ways to speak without language. And I think this does happen, of course, on a daily basis. But I think accessing certain information and other needs can definitely be helped by, these language classes. And one thing I want to mention, something that I've seen working in the UN and also in smaller NGOs in Jordan and Egypt, is that many projects that I've worked on, that I've seen, they not only target migrants, migrant workers, refugees, and asylum seekers, but they also always target the host communities. And I think this is a really good start, and hopefully something that we see not only in these, UN-funded projects, but also other initiatives. I think, if we're including everyone, this not only, helps, but it fosters a more cohesive integration among the host communities and the migrant communities. And I think this is truly what will make a city and a community more sustainable in the future going forward.
This is so true, and I think the solutions that you brought up while answering this question specifically, they're very workable solutions. They're things that can be implemented by not just UN organs, but also different NGOs, like you said, who might be in the process of implementing some of what you were talking about. But I think in the MENA region specifically, we are in need of such solutions that can bring the community together and help migrants mingle in the society and be part of it, rather than always be in their own societies of migrants. Thank you so much for your answer. That was very, very helpful and insightful. And one of the goals of the series, the webinar series that we're making, is to actually get our voices out there and hopefully have different UN organs and different organizations hear some of our workable solutions, and not just the questions that we highlight, or the issues that we bring up, but also the workable solutions that we have on hand. So thank you so much for your thorough answer. And this actually brings us to the end of our episode for today. And I was wondering if you have any additional comments or anything else that you'd like to add.
No, I mean, I think as someone who has worked in the region for the past 8 years, as you had mentioned in the intro, so thank you for that. I think what we're seeing, for including migrants and refugees, if we're specifically talking about COVID-19 within the vaccine rollout systems in Egypt and in Jordan, is something really positive. And, we're very, very grateful as researchers, as practitioners, as migrant communities themselves, that this option is available. But I think one of the key issues is obviously vaccine inequality worldwide. And I think this is just something that I want to mention, because I think people need to be aware that many countries do not have the same access to vaccines as others. And even though these laws and these systems are in place, what we need in Egypt and Jordan, in the region, in the continent of Africa, for example, are access to vaccines. Because not only if we want a healthy society, but if we want a healthy world and we want to see an end to these different variants, we need vaccine equality. So we can only do so much, and including people, if we don't have access to vaccines. So this is just something that I really want to mention, and hopefully this is something that we can come together as a worldwide community to make happen in the future.
Thank you so much for bringing this up. Yes. I think this was everything we had for today. And I think this was a much needed conversation. It's been a pleasure to have you here today.
Thank you so much, Sarah. And thank you
absolutely.
to the UN Working Group.
Absolutely. Thank you so much. And we'll see you soon, hopefully.
Yes, thank you.
Take care.
Bye.